Hello everyone, welcome to Sovereign Health Palm Desert. I'm Dr. Helen Kensley, Program Director, and I'm going to take you on a virtual tour, so follow me. This is Building 1, our admin building. We have all our clinical staff, our clinicians, our case managers, AOD counselors, ClinCon team, marketing. This is my office, and we have private offices in this area. We have our clinical supervisor, associate program director, hospitality manager, our operations manager, senior operations manager. No programming takes place in Building 1. So we're now in Building 2. This is where our Prime Men program. Just to kind of give you an idea of what the day looks like, they reside in residences that are either in the Palm Springs or Palm Desert area. They wake up in the morning between 6 and 6:30, they have breakfast, and they get ready for the day. They are then transported to the treatment center. This is where they receive all of their treatment. For example, case management, individual therapy, group therapy. Once they've completed all programming requirements, they are then transported back to the residences. They cook dinner, they're able to work on step work, homework assignments, things of that nature. Now we're in Building 3. This is where most of our programming takes place. For example, this office is for our psychiatrists. This is where all psychiatric evaluations are completed. Patients are seen within the first 24 hours from the time they're admitted. This is, again, specific for our psychiatrist and his PAs. And in this office over here, we have our lead house managers. And follow me this way. These rooms are where most of the healing and the therapeutic interventions take place. This is another example of one of our larger group rooms. Also to my left, group room. And the Astor room is the room that we use for yoga. We offer yoga twice a week. The next two rooms are used for individual therapy. We offer individual therapy twice a week, depending on the patient's level of care. Some patients don't need individual therapy twice a week, therefore they meet with their therapist at least once a week. To my left, we have our intake rooms. When patients are first admitted, they go through the intake process. They sign consent forms, they sign releases. Once the intake process is completed, they then meet with a clinician to go through the biopsychosocial assessment, which is a very thorough assessment. This is where we screen for primary and secondary diagnoses, underlying psychiatric issues, things of that nature. Coachella is the office of our medical provider. This is where she sees all our patients, specifically all detox patients and dual diagnosis patients. They're screened for underlying medical conditions and treated accordingly. This is our nursing station. Follow me. This area is designated for our medical liaisons and for our medical assistants. Initially, when patients are admitted, they are screened by the nurses. The nurses complete what we call a nursing assessment. This is where that takes place. And if they need medical attention right away, this is what this area is designed for. Thank you for joining me. I hope you had a great time. And if you have any questions, please feel free to reach out.